Welcome to Future of Caregiving.
And about 10 days after I had my second child, I actually had a heart attack. And the craziest part of it is not even me having the heart attack. The craziest part of it was how I was treated when I went to the emergency room to receive care.
Dr. Jonisha Brown attended college at UNC Charlotte, receiving both a BA in biology and a BS in psychology. After undergraduate, she attended Wake Forest University Bowman Gray School of Medicine for medical school and completed her residency at Atrium Health, where she served as the chief resident. Most recently, she graduated from the Harvard T.H. Chan School of Public Health with a concentration in health policy. Dr. Brown's interests and professional goals include addressing racism and implicit bias in medicine, ending Black maternal disparities, and supporting diversity and inclusion in medicine. Hi, I'm your host, Leah Warnke, and this is Future of Caregiving, where we explore the rapidly evolving world of caregiving. From technological advancements to demographic shifts, we'll delve into the challenges and opportunities that lie ahead for those who provide care and those who receive it. Join us as we discuss the future of caregiving with experts, care providers, and those with first-hand experience. We'll examine the trends, breakthroughs, and innovative solutions that are shaping the way we care for each other now and in the years to come. Do you mind starting by just telling us a bit about your academic and career journey?
Yes, for sure. So actually, I'm one of those annoying people who always knew that they kind of wanted to go into medicine, but actually had a very non-traditional path, when it was all kind of said and done. So I went to UNC Charlotte for undergrad, and I majored in biology and psychology. And as a double major, I completely burnt myself out. And so actually leaving undergrad, I decided that I was going to step away from my dream of becoming a physician and pretty much do everything that I thought I might want to do instead of medicine. So during that time, I was a teacher. I did public health a little bit. I also catered. I did psychology-based case management things. And it really led me back to the fact that, I was supposed to be a physician. I wasn't going to be happy until I went to med school. So about 5 years after undergrad, I went back to kind of deciding to matriculate into a medical school, did a post-bac program, which, I'd love to talk about with you too if you're interested, and, delving into that a little bit more. And from the post-bac program, I ended up getting into medical school at Wake Forest School of Medicine. So I matriculated there about 5 years after undergrad, and then went on to do my residency in family medicine at Carolina's Medical Center. And that was a very interesting time. I was a chief resident at the time, but before I graduated, and then really decided at that point that I really wanted to hone in on underserved care, which is one of my big platforms, taking care of vulnerable populations, racially, gender-wise, and also socioeconomically. So that's one of my big platforms. So graduating from residency, did a lot of different work around the Charlotte area. And now I kind of do a very interesting mix of virtual care and academics. And we could talk a little bit more about that. Some of that was born out of COVID. And most recently, I've gotten my master's in public health from Harvard. So did that in the last year in health policy. So here I am.
Wow, thank you so much for sharing, and congrats on your Master's of Public Health, the most recent accomplishment. That is incredible. And your entire academic and career journey sounds very impressive as well. You seem like someone who has been striving for excellence this whole time. So that's awesome that you are in a career now that you feel fulfilled in, and that you are enjoying the work and making an impact on communities that you deeply care about. So this is wonderful. I would like to know more about your post-bac program as well, if you would like to share about that. We have a lot of students who listen to this podcast who are graduating soon or recently graduated and are just kind of wanting to take that time to figure out where they belong, what space they want to enter. So if you could speak to that experience of kind of figuring that out as someone who always knew they wanted to go into medicine and then kind of took a step back to reevaluate.
Yeah, absolutely. I think post-bacs are a great opportunity for a couple of types of students. So, and I was a little bit of both. So, number one, being kind of like this, growing up in a military background, I had the opportunity of kind of like traveling across the world, but really my educational kind of like development came a little bit secondary to that. So, although I was smart, I got good grades, I don't think I ever really learned how to really study. And in undergrad, I did really well, like most of us do who want to be doctors. But as I started getting into those, really like biology heavy, like organic chemistry and things like that, some of them just didn't come as easy. And it was really because I didn't have the study skills. So I had to, develop those study skills. And probably after I graduated from undergrad, I still needed a little bit more development. And I think that's one of the things that postbac's did for me. It's also great for, students who want to take more courses, get more of a kind of like, kind of like foundation before they go into, med school. Like I took biochemistry, different types of immunobiology. All those things really supported me as I went into the medical school space. But I actually did the post-bac at University of Pennsylvania at UPenn. And that was like a special sciences post-bac where you can pretty much do kind of whatever you want it to do, like in the sciences space, and get those extra credits to be able to apply for med school, or for people who still needed their prerequisites, it afforded that opportunity as well. And then I also did the summer program for future doctors at ECU. So that was a great experience. I would highly recommend, your listeners check into that. It's a wonderful opportunity. They help you kind of to get an understanding of what it would be like for the first year of medical school in regards to assessments and how quickly you have to obtain the material. And they also provide a lot of mentorship during that program. That was the space where I think one of my mentors was like, listen, you need to take that MCAT and this is how you study for it. So they're trying to like prepare you for, what it requires to get into medical school. And at the end of the summer, they kind of give you this recommendation that in North Carolina actually holds a lot of weight. I'm not certain about outside of North Carolina, but, they have a med school there. So, it's good for their med school, but then also these other schools in North Carolina, which we're so privileged to have so many, they look at those recommendations very highly. And I think that was probably one of the big points of my application when I finally decided to, apply.
That is super helpful insight. And I think it's so important to recognize that like everyone's path to med school is different. And it's so great to hear that you had so many support resources along the way, and you were able to find like such great programs that plugged you in and got you on this path, and that's really great. I'm interested in hearing a little bit about your work currently. Do you mind describing what you're working on now?
Yeah, so well, first of all, I'm an academic family physician, so I work with the Wake Forest School of Medicine as an assistant professor there, and I'm actually helping to build a curriculum for the new medical school that's coming sometime soon, hopefully in Charlotte. Wow. So that is a mixture of health system science, and there's an extra portion called Ideals, which is inclusion, diversity, equity, advocacy, leadership, and social justice. Is a lot into that curriculum, and so that's been really cool to be a part of. And then also I do virtual care. So out of COVID, for our system that's now called Atrium Health, was developed a program called Hospital at Home. So it is a program where patients who are actually inpatient, so these are patients that would normally be in the hospital building, if they're stable enough, and if their medical care doesn't require certain things anymore, they can actually be transitioned to their home to be taken care of the rest of their inpatient stay. So I work with a team of paramedics and nurses and community, advocates and nurse navigators to kind of help these patients finish out the rest of their hospital course at home with their family, with their own food, sleeping in their own bed. And it has been a great experience. So I've been doing that since 2020. And now we take care of more than just COVID, because before we were just slammed with only COVID for the most part, when hospitals were at capacity, but now we take care of a lot of different disorders at home, and it's really cool. So technically I'm what you would call a hospitalist at this point. I don't do clinic right now, but as a family physician, that can change. You can do a lot of different things. And so that's where I'm at right now.
Wow, that all sounds really like incredibly interesting. And it's nice that you kind of have your foot in a couple of different avenues that both sound, well, one, incredibly interesting and incredibly important. So it's so awesome to hear people out here doing this work. I'm interested in learning a little bit more about both of the programs that you mentioned, but starting with Ideal, the curriculum you're developing there. Do you want to speak a little bit more on that?
Well, we're still developing it, and it's actually what I'll first say is that yeah, medicine in general is when you. I think when I was in medical school and before that, I thought it was about just taking care of patients. But when you get into it, you recognize that there's so many different pathways that you can combine with whatever you decide to do clinically. So clinically means like obviously taking care of patients, right? All those things that we think of when we think we want to be a doctor. But there's academics, teaching, there's research, there's writing, there's leadership opportunities, there's community work, there's so many different opportunities that you can do. And so this one that I'm doing with the med school, what I love about it is that my platform is, like I said, those vulnerable populations, and also about health equity. Now with my master's in public health, it really just allows me to educate the future of medicine on pretty much everything that needs to be there outside of like clinical skills. So someone else is teaching that component of the curriculum, but we're helping students learn about what it is to be a doctor for them individually. How will you be a doctor? What is it to take care of a patient that might have a different cultural background than you? What does it mean to partner with a patient that is struggling with things that you've never heard of? How do you approach that? How does that communication look? What does it look like to partner with your community? Because you can't just be a doctor inside of like, your four walls of the clinic or hospital. A true doctor for a community is in some way involved with the community they live in. So what does that look like? How can that look for you? And just, providing these different resources and partnering with the community, with the medical students to hopefully give them the information that they need to figure out kind of how they're going to plug themselves into this medical puzzle, and hopefully be an advocate for patients and for the community.
I love that. Yeah, health does not just happen in hospitals. So it is so incredible that you are encouraging this community engagement and directing future physicians to complete health outside of just these like brick and mortar hospital settings, but going into communities and building relationships. That's really incredible. You recently shared.
Oh no, I was just going to say, there's like this very interesting statistic that talks about, when you think about what it takes to really keep a patient well, and really only 20% of that like bucket is about like medicines and, prescribing things and diagnosing. The 80% is for the most part what happens outside of the hospital and outside the clinic. So it just really is an opportunity to start a conversation in a different way about, how can we, outside of this urinary tract infection, outside of this, case of pneumonia, once your asthma gets, back, to baseline, how can we keep you well? Like, and that's the conversation that we need to start having in medicine.
Absolutely. Absolutely. And I also want to talk about this other statistic that you shared recently. You said Black women are dying at 3 times the rate of white women from the natural process of childbirth. And this statistic persists across education, financial status. Can you explain a little bit why this is? Like, where is this stemming from?
Well, so I'll also share with you. So this is Black maternal mortality is one of my biggest platforms. And it's honestly because of a situation that happened to me personally. So I have 2 boys, one is 9 and one is 5. And actually all normal pregnancies. I'm a normal, healthy person, exercise, all that good stuff that we, are told to do. And about 10 days after I had my second child, I actually had a heart attack. From something called SCAD, which is a very rare disorder. It's called spontaneous coronary artery dissection. And my pregnancy was healthy. I went to all my prenatal visits. I was already a physician, so I knew all the things to do, and that happened to me. And the craziest part of it is not even me having the heart attack. The craziest part of it was how I was treated when I went to the emergency room to receive care. So I almost was sent home and misdiagnosed because the team did not believe me when I was saying that my heart was flipping in my chest and that I was having as much pain as I was having. And just that experience, I knew the statistic, but it's very different when you have a loved one that experiences it or when it's yourself that's experiencing it. And after that encounter, I really made the decision that's one of the reasons why I went to go get my MPH, to be a part of this conversation a little bit more. And it's happening for a lot of reasons. To answer your question, we think about the easy ones, which are, access problems, like, does a woman have access to, insurance to go get prenatal care? Does a woman have access to quality care? Or, does she have access to, the things that it would take to keep her healthy, during her pregnancy? Those are the conversations that have been happening before. But honestly, the bigger issue is the differential care that Black patients receive in the medical system, secondary to implicit bias and racism within medicine. And I think it's something that, we need to start calling out, not in a punitive way, not to blame anyone, but honestly to try to solve the problem that I think a lot of people are trying to solve, and, that's why the statistic, persists outside of, educational status. I have a doctorate, I have a master's, I have 2 undergrad degrees, and I had, I'm a doctor, so I knew, how to keep myself healthy, and it still happened to me. And, with that came, financial stability, and it still happened. And we see all these other figures like, Olympic, athletes and, Serena Williams. I mean, these people are so healthy, and they're having these outcomes, and they're just, a drop in the bucket. There's women across the world who don't have, higher as high platforms as they do, but are still having these poor outcomes. And the CDC actually has a campaign that that basically says 2 words: hear us. And a big part of it is, having providers, health providers, family members, community people within the community to listen to Black women when they're saying that things are not right, and to help them receive the care that they would give anybody, not asking for any better treatment, but just receiving the same care. Because the literature shows that there's a differential there in the type of care that Black women receive when they're in pregnancy or, around that time of pregnancy.
Wow. These conversations are so important because there is no denying the statistics. There's no denying what is actually happening, and we know what the issues are, and I believe we have ideas of how to help solve these issues. Do you want to elaborate a little bit on that? What are ways that we, as current healthcare providers, as future care providers, can make a difference in this?
Yeah, I think it starts with that listening, so, if you're fortunate to be a provider, and being in that space of being able to make those decisions when that pregnant woman comes in and says that, something doesn't feel right, investigate that with her, ask her the questions, do the tests, instead of trying to brush it away. It's a very critical time for a mom and baby. So, I think in that being a vulnerable space, that is a vulnerable population, doing what we can to, mitigate those problems that can arise later on is big. And it's important not to even think about that as just like OBGYN doctors. A lot of these encounters, like for instance, my encounter happened in the emergency room. So this is a conversation not about just, doctors who take care of women when they're pregnant, but all doctors, family medicine doctors, emergency room doctors, encountering, women at different spaces in the healthcare system and listening to them. And then I think the second part is advocacy, which basically is, amplifying the problem. So, if you're a nurse, if you're a mother of the person who's pregnant, if you're the sister or brother, repeating what they said, no, this is what she said. She's having these problems, we need to do something about it. If you're a nurse, going to the doctor saying, hey, I don't know if you heard her. She said she's in pain. We need to figure that out, so using your voice to amplify their voice, to give them more space to describe kind of what's going on with them, I think is really important. And then also getting the word out in the community about what's happening. I mean, this is an epidemic, by the numbers. It is a problem happening in the nation that needs to have space, that is continually looked at and evaluated and made sure that the outcomes are starting to happen. If not, we're going to be in a worse situation than that 3 times more likely, not too far from here. So.
Yeah, there is not an area of healthcare that could not be improved by listening better to your patients and advocating for them. And so this is so important. Thank you so much for sharing your personal story and your professional realizations as you have built this career in medicine. So is there something that you wish people knew and or cared more about?
I think I would wish, if I had a wish, I think I would want people to be more concerned about their impact, you know, the impact of their actions, not just kind of like, you know, when we think about like ordering a test and knowing it's going to come back, but the way you speak to people, you know, the space that you give people to be themselves, to really start to have that authentic relationship that it takes to partner with patients and to partner with students, you know, in medicine. I wish people, because that's a whole nother story about sometimes how medical education can be less than the dream that you think it, you know, would have been because of encounters with other medical professionals. So, you know, I would hope that people would, you know, learn how to be more responsible for the impact that they have, you know, on people who are, you know, in different spaces than them, to improve kind of like this culture of like mental wellness and health for not just patients, but all of us, because we're, you know, we're all people, we're all struggling with, you know, issues.
Yeah, impact is so important, and all of these little interactions have big impact. It means things to people. They remember these little interactions. So being so mindful of your impact in every space is incredibly important. To round us out, I mean, you've talked about this throughout the entire podcast, but to put into words, what does health equity mean to you?
This is hard. I think it's always changing for me. But I think in general terms, I think for me, health equity means each person having what they need to achieve whatever their level of wellness is, you know, at the moment. Because it changes, you know, when you're a teenager, you don't really think about your diet as much. You know, I don't think you could really fault a teenager for that. But as someone gets older, they might want different information. And being able to, you know, encounter the healthcare system and get that knowledge and get that support that you need to make, you know, better choices for yourself and for your family whenever you're ready to receive it without, you know, punishment or ridicule, I think what health equity means to me. That access without any type of, you know, judgment.
Dr. Brown, thank you so much for sharing your insight with us on this podcast. The conversation has been incredible, and I really appreciate you taking the time.
The pleasure was all mine. Thank you so much.
And that's a wrap for this episode of Future of Caregiving, brought to you by Care Yaya. We hope you've enjoyed this exploration into the world of caregiving and that you've learned something new and valuable. If you want to stay up to date on all things caregiving, be sure to subscribe, rate, and review. And don't forget to check out careyaya.org, where we're dedicated to improving the future of caregiving through technology and compassion. From all of us here at Care Yaya, thank you for tuning in.